वेटिंग में रखा है क्या लोगों को?
यस सर, जब हम स्टार्ट आइकन पे दबाएंगे तब लाइव जाएगा.
Some time.
Recording in progress.
Good morning, good afternoon, and good evening, stream speakers and participants from across the globe. We welcome you all to the global launch of the IPA and ACS online course on HPV Vaccinate Adolescents Against HPV Cancers. Before we go into the event, we will go through the rules and instructions. We will have 4 live polls throughout the session and you will have 1 minute to respond to them. If you have any questions for the speakers, kindly put them in the Q&A feature. The brief bio of each speakers will be shared in the chat feature of Zoom. To receive the certificate of attendance, participants must attend the entire duration of the event and complete a feedback form which will appear on your screen once the event is complete. Please note that the Zoom closed captions are generated by AI and there may be instances where the translations are incorrect or misleading. We appreciate your understanding in that. Now, it's my honor to welcome Dr. Naveen Thakkar, who is an MD Pediatrics. He's the Director of Deep Children Hospital and Research Center, Gandhidham, Gujarat, India. He's also the Executive Director of the International Pediatric Association. He also serves as the co-chair of the IPA program area on immunization and infectious disease. Over to you, Dr. Naveen.
Thank you, Aishwarya. We are honored to have you, so many colleagues from around the world joining today. And today is the International HPV Awareness Day. And very important step in that direction is launching of this online course. Many of our colleagues have joined here as a panelist, as a speaker, and you will hear from them throughout the this launch session. Can we have the poll, Aishwarya?
Yes.
First poll was also not completed.
Yes.
Yeah. So this is, you can see, and just you have 1 minute to complete. Okay, so thank you so much. And now this is, okay, one more poll.
That's fine. Share the
Okay, this is the result. Okay,
yeah.
Okay, perfect. We can close this. Okay, so now this is my honor to present to you our President, Dr. Professor Joseph Haddad, who has joined from Lebanon. You all know what's happening there, but still he has been very kind enough to join this important event. Over to you, Dr. Joseph Haddad. You are muted. You are muted.
You are right. Good day to everyone. Today, I'd like to talk about pediatric leadership in prevention and the crucial role of medical societies that play in this effort. As we know, childhood is a critical period shaping not only health, but also the future of the society. Preventive care is essential in pediatric medicine, encompassing screening, immunization, nutrition, and mental health support. Pediatric leaders, including physicians, nurses, allied health professionals are at the forefront of shaping this preventive strategies. Their leadership fosters collaboration among diverse stakeholders, including families, educators, and community organizations. By prioritizing preventive measures, these leaders can significantly reduce the burden of childhood diseases and improve lifelong health outcomes. Medical societies such as the International Pediatric Association and others have a pivotal role in this landscape. They provide evidence-based guidelines, support ongoing education, and advocate for policies that enhance the health of children. Through networking opportunities, particularly with the American Cancer Society here present, and I wish to acknowledge them and thank them for this wonderful webinar. The IPA will empower pediatricians to share best practices and innovative around prevention. Additionally, the International Pediatric Association facilitates research funding and dissemination of new findings, ensuring that the latest advancements in pediatric care are accessible to practitioners on the ground. Their effort in public health campaigns also raise awareness about critical issues like vaccination and others. In conclusion, pediatric leadership in prevention is vital for safeguarding our children's health, and medical societies are essential allies in this mission. Together, dear friends, all of you, we can create a healthier future for our youth, a world fit for our children, ensuring that we thrive both physically and emotionally. Thank you very much, and this is over to you, Aish. Now, I wish to introduce our dear friend, Dr. Anurag K. Agrawal. I hope I have did it correctly, who is the Vice President of the Global Cancer Support of the American Cancer Society. You have the floor, Dr. Anurag.
Thank you so much, Professor Haddad, and thank you, Dr. Thakur, as well. It's really my privilege and pleasure to be here today, and thank you all for joining us as well, everyone here that's participating in the webinar. It's an honor and privilege for us at the American Cancer Society to launch this partnership with the International Academy of Pediatrics. Really, it's such an important mission working together, the International Pediatric Association. It's really such an important mission, as Professor Haddad said, and as both a pediatric oncologist as well as a parent, this work carries deep personal meaning for me. I've been with so many families on their hardest days, when a cancer diagnosis changes everything, or when you have to tell somebody that they're not going to live because of a cancer. And as a parent, I know, as many of you do, the instinct that we share to protect our children as much as possible and give them that chance to grow up healthy and safe. And first and foremost, even before being a pediatric oncologist, as a pediatrician, I know how important our role is, as Professor Haddad said very clearly. Today, together, we stand at an incredibly historic moment in global health. For really the first and only time, we have the opportunity to eliminate a cancer, and specifically cervical cancer. HPV vaccinations are extraordinarily effective, but now more than ever, with everything that's happening in the world, all of the misinformation, their impact really depends on the confidence and leadership of healthcare providers everywhere. That's why this partnership between a cancer society, the American Cancer Society, and a pediatric association are so important. These two really together can show the importance of the message. And as Professor Haddad said, with medical societies around the world, we can together expand access to trusted, evidence-based training on HPV cancer prevention, vaccine science, and communication. Your leadership truly does shape practice, builds trust, and brings prevention within reach for every community. You all are incredible advocates and incredible leaders, and by working together, we can change the trajectory of HPV cancers and help ensure that the next generation grows up free from these preventable diseases. Again, thank you for joining. We really appreciate the partnership and your dedication to this shared mission. Next, I would like to introduce my friend and colleague, Dr. Partha Basu, who is the head of Early Detection, Prevention, and Infectious Branch at the International Agency for Research on Cancer, which is part of the World Health Organization, WHO. Thank you. Over to you, Dr. Partha.
Thank you. Thank you so much, Dr. Agrawal. Let me try to share my screen. Is it okay? Can you see my screen?
Yes.
Can you confirm?
Yes.
Great. Thank you. Good morning, good afternoon, everyone. Especially warm greetings for Holi, the festival of color. And as you have heard, that today is the HPV day, or rather I would say HPV elimination day. Cervical cancer is a cancer that very nicely highlights the global inequity that is there in healthcare. If you look at this map is showing the mortality from cervical cancer across the globe. The countries that are in deep red are in sub-Saharan Africa. Unfortunately, India is still among those countries in deep color, and then some of the Latin American countries where cervical cancer death is very high. And on the other hand, if you look at the global north, where there have been cervical cancer screening program for so many years, they have introduced the vaccine now in some of the countries more than 15 years, cervical cancer mortality is extremely low. So this is a cancer which has now become the second most common cancer, because earlier it used to be the number one cancer. Now breast cancer has become the number one cancer in terms of incidence, but cervical cancer is more lethal. So that is why when it comes to mortality for deaths, cervical cancer is number one in most of these countries. So that we should keep in mind. Cervical cancer can be eliminated essentially because we know the natural history of the disease very well. More than 95% of the cervical cancers are caused by persistent infection from certain types of human papilloma virus. Now, this viral infection is quite common, but then most of the women who get the infection, they clear the infection. In a certain proportion of women, the viral infection remains persistent, and then they progress to a precancerous stage, which can be detected through screening. And if the precancerous stage is not detected, not treated, then the woman progresses to cervical cancer. So there are two excellent ways for preventing this cancer. Number one, through vaccination, which we are going to discuss today. Another is screening, detection of the precancerous disease, and treatment of that precancerous disease. Now, this is the global map that is showing the countries that have introduced the HPV vaccine, and the countries in brown are the countries where they have introduced the vaccine with a single dose. And it gives me a great pleasure to see India being part of this map. India is part of the 155 countries across the globe that have introduced the vaccine for its girls, and it is with a single dose, because now we have enough evidence from one of our IARC study where we are following 17,000 girls after vaccination over the last 16 years. And we are seeing the single dose is as protective as 2 or 3 doses. Now, as in the front line of healthcare, as specialists, as general practitioners, as nurses, even NGO representatives, you will be facing different questions, doubts about this vaccine. That's very natural. So first and foremost thing is the vaccine effective? This is a graph that is showing the effect of the vaccine in eliminating HPV 16 and 18 from the women who received the vaccine. So this is the graph from Sweden, which introduced the vaccine in 2009 or 2010. So those who were born after 1984, they received, they had the advantage of getting the vaccine. And over the years, as the vaccine coverage has increased to more than 80%, you can see the HPV 16 and 18, which is responsible for nearly 80% of cervical cancers. It has been totally eliminated from Sweden. And this is exactly we are going to see in all the different countries that have high coverage of the vaccine. And there are always, people who will be doubting this vaccine. Oh, it does not cause cervical cancer. It does not prevent cervical cancer. Where is the evidence? This is the evidence. These are the countries, again, Sweden, Denmark, Norway, that introduced the vaccine in around 2010. Within 15 years, you can see the cervical cancer incidence in the young women who got the benefit of vaccination. It has nosedived. It has got significantly gone down because of the vaccination. So there is enough evidence that the vaccine is preventing cervical cancer as well. Another myth that is there in Indian, even among clinicians, that among Indian women, the HPV infection is not that common, which is not at all true. This is from our own study, from a multicentric study from India, where young women between 8 to 24 years of age, as they get married, we have started collecting cervical samples yearly and tried to see how many of them they get different HPV infections. And as you can see, within 5 years of follow-up, 9.2% have been detected to have HPV 16 and 18 infection. More than 30% of them were detected to have some or other HPV infection. So Indian women, they have same risk of having HPV infection as anywhere in the globe. Another issue, which I think it's a messaging issue, if you talk about the incidence of cervical cancer, it is in India, it is 13.3 cases per 100,000 women. And some people will say, oh, more women die of road accidents every year. But this 13.3 cases, it is every year, this is the incidence. Actually, if you look at the lifetime risk of an Indian woman, it is 2%. That means out of every 50 women, 1 woman will get cervical cancer. So that is the real risk estimate. And if we would have delayed further the introduction of the vaccine, we would have pushed 160,000 girls every year to get cervical cancer over their lifetimes. So we need to understand this concept of risk. This vaccine is one of the most highly scrutinized vaccine. There is the WHO. There are multiple international bodies, including the EMA in Europe, the FDA in USA. They are constantly monitoring this vaccine. And there is very strong, reassuring statement, as you can see here from the WHO. So, my suggestion in terms of the messaging would be, as you discuss with the parents, as you discuss with the girls, highlight the disease that is being prevented by the vaccine. HPV infection, as I said, is a very common infection. So the vaccine is not there here for prevention of HPV infection. It is to prevent some very serious disease like cervical cancer. It can also prevent some other cancer like anal cancers, oropharyngeal cancer. So it's a vaccine that can prevent multiple cancers and reinforce the fact, as I said, and then showed you the evidence that it is very effective, very safe. Even our Indian data is showing that the vaccine is affecting more than 90% efficacy in preventing 16 and 18 persistent infection. And none of the vaccinated women in our study have been detected to have high-grade precancer or cancer till now, whereas in unvaccinated, we have already detecting those. And it is extremely safe, but listen to the concerns of the parents. They will have concerns. It is important to listen to them and appropriately respond to those. And as a gynecological oncologist, when I used to practice in the National Cancer Institute in Kolkata, day in and day out, I have seen the suffering of the women who are in their 40s. Cervical cancer is not a cancer that affects women in their 60s or 70s. It affects women early. And these women are often detected at a late stage and then die a very painful death after a lot of suffering. So here we have, rather you have, the power to prevent this cancer. And keep in mind that it is just not the cancer of the women, it is not the death of a woman. We have evidence at IR that out of every 100 women dying of cervical cancer, 14 children, they are the orphans, we call cancer orphans, will die before they reach the age of 10 years in the poorest communities. Thank you so much for your patient listening. I would take the questions as we keep discussing. It's my pleasure also to introduce Professor Noni MacDonald. Professor MacDonald is Professor Emeritus of Pediatrics, Infectious Diseases at Dalhousie University and at the IWK Health Center in Halifax, Canada. She is a former Dean of Medicine. Over to you, Professor MacDonald.
You are muted. Noni, you are muted.
Thank you, Professor Artu. He has laid out how important and common cervical cancer is and why we need to do something. And you, every single healthcare worker who is tuned into this presentation today, can make the difference, because we know study after study has shown the most important influencer of the decision to accept the vaccine for children by their parents is being told by a healthcare worker the information they need to make that decision. You can make that difference. It's a matter of stepping up. It's what you say, how you say it, when you say it, who you get to align with you, working with your national association. Can you bring up the poll, please, Ashwara?
Yes, Dr.
So, have you personally recommended the HPV vaccine in the past week? One choice only. You did or you did not? Please answer.
Noni, past week is too short a time.
If people answered, it shouldn't take long to answer this poll. You only have two choices, so please vote. There we go. Oh, look at this.
Wow.
71% is a yes, 29% is a no. What's important here is you have to bring this up. It's not just at the time you want to get that vaccine in there when they're in the office and it's a 9 or a 10-year-old girl. You need to prepare them for this over time. This is true for all the vaccines, how important they are. So it is my privilege now to introduce the next speaker, which is Dr. Jessica Khan. If you can bring the slide up, Ashwara. Who is a professor of pediatrics. She's the Senior Associate Dean for Clinical and Translational Research at Albert Einstein College of Medicine in New York City in the USA. And she is going to give you an overview of the course and the introduction of the Medical Society Guide, because we know that many people need to know how to do this communication well. Over to you, Jessica.
Thank you so much, Dr. McDonald. Greetings, everyone. It is a true honor to be here with all of you today. So as you have heard, we are at a pivotal moment in the global effort to eliminate cervical cancer, and your leadership is critical. So thank you so much for joining us today. It's my privilege to introduce you to HPV Vax. It's an initiative that aims to support medical societies and individual healthcare professionals in advancing HPV vaccination. And HPV Vax HPV Vax will provide you with actionable information about HPV-related cancers and HPV vaccination, practical strategies for communicating with adolescents and their families, and tools and resources for use in your clinic and community. HPV Vax, also known as Vaccinate Adolescents Against HPV Cancers, includes a 7-module course and resource materials that are designed to strengthen and support healthcare professionals and pediatric societies in their efforts to increase HPV vaccination across clinics and across communities, regions, and countries. And you can register for the HPV Vax course on the IPA website through the IPA Learning Management System, and screenshots of the registration page are shown on this slide. On this slide also is a QR code that you can use or you can share to register directly. Next slide, please. Thank you. So this training and the resources are free for all healthcare professionals anywhere in the world. And the training provides information about the science of HPV-related cancers and HPV vaccination. It provides strategies for effective communication with patients, with families, and it provides ready-to-use culturally tailored tools and resources to help you recommend HPV vaccines. This training is self-paced. It takes about 4 hours for all 7 modules, and participants all receive a certificate for completing the course. Training is now available in English, and Spanish and French versions are coming soon. Next slide, please. These are the course modules. I'll go over them very briefly. Module 1 focuses on the HPV-related cancer burden globally. Module 2 on primary prevention through HPV vaccination. Module 3 focuses on making effective HPV vaccine recommendations. Module 4 on answering parental questions, concerns, hesitancy issues. Module 5 focuses on the cervical cancer burden and an elimination strategy. Module 6 on healthcare provider champions and how you can foster those to increase HPV vaccination in your communities. And Module 7 focuses on activating your medical society. Module 6 and 7 are panels of global experts. And coming soon is a final module on single-dose HPV vaccination. Next slide, please. So in addition to the modules, we provide a comprehensive action guide for medical societies and healthcare professionals. And this includes background information on HPV cancer statistics and facts that you can use in your counseling, actions that medical societies can take, and additional resources. Some of the actions that are included in this guide are first, alerting society members and other healthcare professionals about their pivotal role in preventing HPV-related cancers through HPV vaccination of adolescents. Secondly, cultivating member champions who will advocate for increased administration of the HPV vaccine among both peers and among parents and adolescents. And third, recognizing and sharing successes in increasing HPV vaccination in clinics and in communities. Next slide. The action guide also includes an editable action plan template to help medical societies in any country plan specific activities in alignment with the action guide for medical societies. And you can use this step-by-step guide essentially for program management as you implement HPV Vax in your medical society. Using this template, you can plan and track specific goals. You can plan and track activities to meet those goals and who is responsible for each activity. And also you can track the impact of these activities. Next slide. And finally, we very much want to hear from each and every one of you so that we can all learn from each other, from our successes and from our challenges, and also so that the International Pediatric Association can amplify your successes. So please let us know what you think about using the guide. Please send us actions that you're taking in your community or your country, and please share your successes in stories, in photos, however you would like to share those successes. And you can either scan this QR code or you can click on the link on the IPA website to add your story to this global movement. So I think that now we are going to shift to a poll. And the poll asks how your medical society or organization currently engages healthcare professionals on HPV vaccination. Here's the poll. So please choose, this is a single choice, so the most common way in which your medical society or organization engages healthcare professionals. Let's look at these results. So the most common response is continuing education, followed by public awareness campaigns, clinical guidelines, advocacy initiatives, school awareness. So thank you for completing the poll. What we hope is that the webinars and the resource guide that we'll make available to you through HPV Vax will give you suggestions as to how you can improve your current engagement practices and also expand to additional engagement practices. And we'll give you the resources that you need to help you in your efforts, including fact sheets, posters, handouts, social media posts, and so on. So it has been a great pleasure and privilege to introduce you to the HPV Vax program. And now I am delighted to introduce our next speaker. And our next speaker is Ms. Aishwarya Satyan. And Ms. Satyan is a project consultant for the International Pediatric Association, and she will be describing to you additional resources that are available to you through HPV Vax. Thank you very much, and over to you.
Thank you, Dr. Jessica. So today, here we have ready-to-use resources that are designed to help us turn the evidence into action. The science is clear, but the HPV vaccination works. But the main question is not whether we can prevent these cancers. The question is whether we will act early enough and boldly enough. First, we have the parent education posters, which you can see. These are advocacy tools. They speak directly to the families in clear and simple language. Like HPV is common, cervical cancer is preventable, vaccinate between 9 and 14 years, don't wait. Displayed in clinics, schools, and communities, they normalize HPV vaccination and spark conversation that save lives. And we have posters adaptable across different regions of the world. Second, we have the physician handout. We know that one strong healthcare provider's recommendation is the single most powerful prediction for vaccination. What we say matters as a healthcare provider. How we say it matters even more. Providers to confidently address the FAQs they have from parents. The third one we have is a parent handout. Don't wait to vaccinate. This reinforces urgency. HPV infection is common. There is no treatment for HPV itself, but there is a safe and effective vaccine. And timing matters. When we combine clear public messaging, strong provider recommendations, and informed parents, we close the gap between policy and protection. Now, this is the social media toolkit which we'll be providing. Here, in which you will find a flyer, sample, website or newsletter content, and social media messages that you can share within your networks to engage them in the HPV Vax training program. The target audiences for these materials and messages are healthcare providers, medical societies, and public health professionals. You may use the suggested text as in or modify it to fit your audience. Please do not modify the images, but you can put your images of logos if desired. Please share these resources with other partners as well. And thank you for joining us today to increase HPV vaccination to prevent cervical cancer. Now it's my honor to welcome our next speaker, Ms. Madhumita Singh. She's an MBA in Healthcare Management and Bachelor of Physiotherapist. She's currently working as a project consultant at the International Pediatric Association. Over to you, Madhumita.
Thank you so much for the introduction. As we all know, pediatrician stands at the center of this opportunity as a trusted voice for families and lifelong advocates for childhood. But these efforts belong to all of us. Eliminating cervical cancer requires united action across the entire health system, including pediatricians, nurses, primary care providers, public health leaders, and national societies, working towards one shared goal. The International Pediatric Association, together with the American Cancer Society, is proud to support a growing global movement aligned with the WHO target of vaccinating 90% of girls by the age of 15. The video will show you are about to see both as a reminder and a call to action. To cervical cancer elimination is within reach if we act together and act now. Now let's watch and then let us lead. Mr. Adarsh, please put the video. Thank you.
Cervical cancer is one of the most preventable cancers in the world, yet it remains a leading cause of cancer deaths among women in communities across low and middle-income countries. Nearly 90% of cervical cancer deaths occur where access to prevention has been limited. But this story can change, because the path to elimination begins long before disease ever appears. It begins with protecting children. The International Pediatric Association is proud to collaborate with the American Cancer Society to lead global efforts to change this story. As the most trusted voice for child and adolescent health worldwide, IPA supports the fundamental truth. Cervical cancer elimination begins in childhood through timely HPV vaccination. For pediatricians, HPV vaccination is more than routine care. It is HPV cancer prevention for life. Eliminating cervical cancer takes the whole health system. Nurses, primary care providers, community health workers, and public health professionals working together. When vaccination is everyone's responsibility, every girl has a stronger chance to be protected. This movement is already underway. 13 national pediatric associations from diverse regions have joined this commitment, standing with IPA and ACS to advance HPV vaccination and support the World Health Organization's goal to vaccinate 90% of girls by age 15. Their leadership shows what is possible when healthcare professional voices unite around a shared purpose. Cervical cancer elimination is within reach, but only through collective action. The International Pediatric Association and the American Cancer Society invites pediatric societies, healthcare professionals, and partners everywhere to join us. Every child deserves protection. Every community deserves a future free from cervical cancer. Together, we can achieve 90% HPV vaccination in every community and move closer to eliminating cervical cancer for future generations.
Now I would like to welcome again our Executive Director and Global Pediatric Leader, Dr. Naveen Thakkar. Sir, over to you.
Thank you. Aishwarya, you can stop slide sharing. So thank you so much. I think my team and all the speakers have covered practically everything. I just want to, my topic this time was how to act as a medical society, SCP, and CSO or NGO. So all medical societies, you have already voted and you have been told to say only one action which you have taken most routinely, but I would request, you know best how to involve your members, and we should do everything whatever is possible. So that is for medical society. For healthcare professional, it has been very well said by Noni, Aishwarya, Jessica, everyone, that you are the trusted messenger. I have my friend Todd here, who runs a very good program of Trusted Messenger. You should also do that. So you are the trusted messenger. You are a medical professional. Your recommendation count, but when it is done with confidence and with empathy. So we will discuss that during our course, and you have to make a strong recommendation without hesitation that HPV is a very safe and effective vaccine. But you have to do that with empathy and with confidence. Now, finally, about civil societies organization and NGO, you are the connecting force. You have to see that there are collaboration. You have to make people accountable. So you have a very important role to play, and this is why we are bringing everyone here together. So as you've seen that 12, 13 society have joined. All those are English-speaking societies. We in next phase we will be recruiting, working with more 20 societies from Latin America, Spanish and French. And as you see that we will have very active support. So please, if you are interested, and also other English society, if you are interested, please write to us, and we as the interest comes, we can include that in our active program. Thank you so much. And I like to introduce our for the panel discussion, Dr. Meenu Anand. She is the director. Dr. Meenu Anand, Director of Global Cancer Prevention, American Cancer Society. And let me tell you that she is the force behind this movement, and she has kept us very busy for last 1 year or so on every Tuesday. You can see how much preparation has gone into this. So Meenu, I invite you to moderate the panel discussion.
Thank you, Dr. Thakkar, and welcome everyone. It's my honor now to moderate this esteemed panel of experts from across disciplines who share this one purpose: accelerating HPV vaccination to prevent cancers. As you have heard, the science is indeed clear, but to ensure that every child grows up protected requires strong systems, informed providers, and confident communication. Today, our panel will help us explore why HPV vaccination matters now, how different healthcare workers and partners can strengthen uptake, and how this course can support better practice and collaboration across settings. Thank you for being part of this effort. Let's begin. My first question goes to Dr. Paul Bloom. To start us off, Paul, let me pose a question. Why does focusing on HPV vaccination uptake matters right now?
Thank you, Meena, for that very important question. First, let's us celebrate really the amazing advances that HPV introduction has seen over these last years worldwide. So just think about this. Nigeria, with 34 other countries in Africa, is using the vaccine. Pakistan, with Saudi Arabia, Tunisia, and many new countries in Middle East are using the vaccine. China has introduced the vaccine not long ago with 90% of all the countries in the Pacific. And last but not least, India introduced last Saturday, and with it, nearly all the region in Southeast Asia. So things are going well, but why is it urgent? So first, there are still 30 countries remaining that need to introduce the vaccine. And I think your members, your societies in the countries are a super important voice to introduce this vaccine in the systems, in the EPI programs, and you will have to do the advocacy for that. But secondly, we have another issue, and that's about coverage, or let's say acceptance. So when we make the statistics at WHO, which is where I work, and we look every year at how the programs are doing, we see that across the board in all countries, around 65% of girls are reached. You may think that's good. For a vaccine program, that's very low. It's about the lowest of the coverages among all the vaccines. So actually, that's where we can make a lot of gain. 35% of all the girls every year are basically not reached, even though their country is offering it. And that's where we come in, I think, as individual pediatricians. That's why this course is so important. That's why the work that will be done by all the societies and that is being done is important. So, you know, raising the coverage and helping countries to introduce, those are the two urgent issues. Thank you.
Thank you, Dr. Bloom. That sets a powerful foundation. Dr. Sandra Torres, or Miss Sandra Torres, building on that, IPA is leading this initiative, but pediatricians alone can't reach every child. What role do nurses, midwives, and community health workers play that might be underutilized in improving HPV vaccination today?
Well, first of all, thank you very much for being part of this amazing panel today, and congratulations to the International Pediatric Association and partners for launching this important course. And of course, thanks so much for this question. And I really have to say that midwives, nurses, pharmacists, and community health workers, of course, represent one of the greatest untapped opportunities to accelerate the HPV vaccination globally. While vaccination programs are often designed around physicians, usually, the reality is that many of the most trusted and accessible health professionals in communities are these frontline providers that are usually very close to the communities. In many countries, of course, nurses, midwives are the primary providers of sexual and reproductive health care across the course of life, of course, of women. And according, in this case, to the International Confederation of Midwives, midwives are trained, of course, to provide health promotion, counseling, and preventive services that support the health of women, adolescents, and families. So all these competencies, of course, that all these different healthcare professionals have are really important when we want to really pass the information, as the doctors were saying before, of course, and make it accessible to everyone, the opportunity to have the HPV vaccination. So these positions, midwives and nurses, of course, vary in the main spot to support the HPV prevention. They often have long-term relationships with women and families. That's very important because we are there every day of the communities. And we, of course, we can integrate conversations about HPV vaccination with other services, such as adolescents, for example, the counseling, reproductive health care, and cervical cancer screening also. And also on the other side, we don't have to forget pharmacists also. They're also really representing a growing opportunity to expand vaccine access at the communities. They're also in many settings, just with us, with midwives and nurses in the communities. So it's also very important open door to really, think that we have to work together to make it happen. And on the other hand, community health workers, of course, as midwives, nurses, and pharmacists are also very close to communities, and they play a critical role, and usually in rural areas when there are marginalized communities where misinformation, stigma, or limited access to services, of course, may reduce the access to these vaccines. So as you can see, all of us can, of course, be really helpful in this area to provide the necessary information and the trust for the families to access the HPV vaccination. And of course, we know that we have a lot of potential as healthcare workers, and we know that we're underutilized in this area. And too often we are not very included in every other plan, immunization plan at the country level. So this is really important. This course, of course, to highlight that we should be there, of course, in training and of course participating in policy frameworks. In this way, we move forward with HPV vaccination. So this is why this course is so important, because of course it provides practical information, tools that we already seen, knowledge that we as health workers can of course use at the local level. So this is really important. And of course, from our perspective, from the International Confederation of Midwives, of course, strengthening the healthcare workforce is essential to accelerate the progress towards eliminating all aspects related to cervical cancer. And these global initiatives like this one is really important, because we are here, of course, to prevent and to work together, as Dr. Naveen was, of course, saying and telling us before. So thank you very much.
Thank you, Sandra. Really appreciate highlighting those important touch points, both with advocacy and in communities for delivering HPV vaccination. Next question, I would invite Dr. Prasad to reflect on the fact that despite strong safety and effectiveness evidence, provider hesitancy still exists. From your experience, what are we getting wrong, or what could we do more in how we communicate the evidence to clinicians?
Hi, thank you for that question. And yes, I agree the hesitancy remains in the healthcare providers, but not very rampant, I would say. It's definitely most of the physicians, pediatricians are aware about the importance of this vaccine, but there are, of course, some pockets where the challenge remains. And there, I think we need to work little hard, because first of all, the problem is, again, even the physicians are exposed to the same misinformation as the patients are. And as far as HPV is concerned, we all know that social media has been very overactive in spreading the information, and that spills over somehow to the medical community as well. So we need to really give a very strong evidence, and we need to go back to them again, talk about the safety of the vaccine. I mean, the situation what was there 10 years back is no more there. Hundreds of millions of doses have been used. Safety has not been a problem at all. This is one of the safest vaccines, and so safety is not a concern. We already know that the vaccine is highly effective. The countries where the coverage has been excellent, the prevalence of the infection has gone down, cervical lesions have gone down, cervical cancers have gone down. I mean, there is enough evidence already. So we need to give that evidence to these physicians again, that this is about the benefit risk balance, and benefits are far outweigh than the very minimal, very minor risks. So I think that message has to go. Secondly, what I also see that somehow the perception is among the parents and among the communities that this is a sexually transmitted infection. And that conversation with the parents for a healthcare provider becomes little awkward. That becomes little challenging. So instead of focusing on the STI part of it, I mean, we need to keep in mind that even hepatitis B gets transmitted sexually, but nobody talks about that, and there is no resistance at all for hepatitis B vaccine. In the similar manner, we need to highlight that how this vaccine is actually preventing cancer, not just cervical cancer, but other cancers, anal cancer, oral cancer, vulval, vaginal cancers, and of course, many other lesions. So that message has to go to the physicians very emphatically. And I think that really should work, that this vaccine prevents cancer. I think that simple message will really go in a long way if we can give that message to them.
Thank you, Dr. Kulkarni. Great points. Dr. Woolen, perfect segue to bring you in to this conversation. As you know, this course covers both science and communications with parents. Many healthcare providers, workers already understand the science. As Dr. Kulkarni even mentioned, why is strengthening communication skills among healthcare providers equally important?
Well, first off, it's an honor to be here, and thank you for the ability to participate in this developing this course. So why is communication important? Well, I would tell you it's where we're failing, and that's true globally. So the science isn't failing us. As a matter of fact, the science has never been better. Where we fail is the communication. And we've heard the words trust discussed already. We have data that is global from multiple countries, 16,000 people surveyed year upon year. I think it's the Edelman Trust Barometer, and it continues to show that healthcare providers remain the most trusted globally. The trust is local, so it's down to the level of their practitioner. It isn't just physicians. It can also be, as we've heard, nurses, nurse midwives. I was a board certified lactation consultant for 25 years. Anyone who's in a position of trust, who's speaking to families, has an immense opportunity to impact their decision making. It is true, these devices are polluting everybody's mind with social media, which basically has algorithms that deliver you your own personalized slice of hell. If you're the parent of a childbearing a child who's going to be childbearing age in the next several years, you'll hear fears of sterility or infertility. So how do we combat that? Well, the most powerful way is with communication. And so the problem is none of us received in nursing school, medical school, pharmacy school, communication training. None of us. And it's where we fail. So basically now we have healthcare providers telling us globally that they feel that almost every visit is somewhat contentious, or they're fearful in making a recommendation for something that they know is now a hot topic on social media with lots of inaccurate information. And so they water down their recommendations. We've had healthcare providers telling us nationally and internationally that they no longer make what's called a presumptive recommendation. Today, your daughter is due for this vaccine, or today, I recommend she get this vaccine as quickly as possible if you don't offer it at that site. And they're switching to the type of recommendation where they say, would you like to discuss vaccinations? In my mind, that's like saying, would you like to wear a seatbelt in a car? Or would you like to, consider sunscreen? Who would do that? We would not abandon the science. So the communication training teaches us to make confident recommendations because our patients are looking for us to be confident. We are the experts on the medicine, but we also need to be prepared when they have questions. This is a big issue now, particularly again, fueled by what we've been hearing about coming on these devices, that if somebody asks questions or has been impacted by inaccurate information, we don't have to become defensive and view that as a battle. What we need to do is recognize that people have the right to ask questions, and then we engage them in sincere discussions, that we want to learn where they're coming from, understand the information or inaccurate information that they've heard, and then be able to address those types of concerns. Basically, as part of this module, we have steps that include this process, where if they don't accept your recommendation immediately, rather than again getting defensive, that we inquire, we learn about their concerns. Basically, what happens is our instincts fail us as healthcare providers. We're trained to go up here. So if somebody says, I'm scared that this immunization could cause infertility or cause cancer, we want to immediately show them why they're wrong and why they're right. And once they see that, they'll then come over to our side. That's not how decisions work, not even for us as healthcare professionals. It's down here. Aristotle said 2,000 years ago, pathos, things like emotions, beliefs, and values really drive our decision making. So through the communication process, we can then not only inquire, but mirror back people's words to them to let them understand that we're using active listening, that we're sincerely interested. And then we can express, Naveen said it in the beginning, empathy. You aren't magnifying a myth by validating somebody's fear. So by saying, my goodness, if I thought that were true, that would scare me as well. It's very different than what healthcare providers are doing globally today. We typically want to throw data at people, go up here, or we want to scare them out of into vaccinating, but you can't scare the fear out of somebody. So we have to learn how to go from here down to here to understand where they're making their decisions based on their values, beliefs, and fears. Once we access this, once they see we're not there to judge them or demean them or to pressure them, then the discussion becomes a much better dialogue. They have increased receptivity, and then they're willing to listen, even to information like data, or if you have some stories that are kind of scary, but you're not using them to scare them, but to show why you're scared of this disease and why it's so important to get the immunization, then we can reach a really good place and build trust. So the newer designs around communication is about trust building, even if you still walk away from that visit not agreeing, because it sets the stage for further discussions and agreement down the road if you don't get to agreement on that first visit. Thanks.
Great points. Thank you very much, Dr. Woolen. Let me bring you into the conversation, Dr. Rajat Khosla. Dr. Khosla, looking ahead, how can this course become a platform for ongoing collaboration among regional, national, and global stakeholders, rather than just a one-time intervention?
Thank you, Dr. Anand, and great pleasure to be here. And the good part of coming so late in the conversation is that a lot of things that you wanted to say are already being said. So, very helpful and very, very intriguing conversation and the variety of perspectives. The one thing which I will do in the couple of minutes that I have for my remarks is also to try and link this to respond to your question within the broader trends and conversations that we are having within the sexual and reproductive health and rights context and the challenges that we are facing. And I think this will be a very well accepted fact for everybody on this call, is that global health is standing at a pivotal moment, and as many would have said, at a crossroad right now. We have within our reach the tools that are available to prevent cervical cancer and other HPV related cancers. And as everybody else has said, the question that we need to be asking is why those tools are not working or are not accessible to those that need it the most. The HPV vaccination and the broader sexual reproductive health and rights agenda is facing growing challenges as restrictive policies and the spread of misinformation erode trust. The fiscal constraints place increasing pressure on the health systems and communities. And we are now looking at these conversations in the backdrop of the dramatic aid cuts that happened in 2025 and the incrementally decreasing global health funding that is available and funding that is needed to support initiatives like this. Although within this challenging context, initiatives such as the Vaccinate Adolescents Against HPV demonstrates what is possible through the strong collaboration and partnership. They should not be seen as isolated efforts, but as foundation for sustained collective action to advance the adolescent health and well-being agenda across the life course. And a couple of facts to state in this case. We know that there is a direct return on investment on HPV vaccination, and it is very compelling. In 2023, my organization released a comprehensive investment case on adolescent health and well-being, showing that every dollar invested in HPV vaccination and screening, there is an economic and social return of more than $20. It's really stunning. The question is, why is the government not investing on this to scale? The HPV vaccination among adolescents and young people is a critical entry point for comprehensive sexual and reproductive health and rights, as it does not only protect against HPV-related cancers, but also creates opportunities to deliver integrated, age-appropriate information and services that inform life choices. This is especially critical at a time when we are witnessing unprecedented pushback against sexual and reproductive health and rights in pretty much every region of the world, and now compounded with the reinstatement of the global gag rule or the Mexico City policy by US government, and now expanded to include other areas and its application to multilateral organizations and governments as well. Tools such as the course developed by IPA and the American Cancer Society can serve as a vital bridge between global guidance and action on the ground, particularly when integrated and scaled within both pre-service and in-service training curricula. At global level, they provide standardized evidence-based content. At the regional level, they enable adaptation and peer learning across contexts. And of course, at the national level, they support implementation through health systems, professional association, and training institutions, many of whom are present today. Therefore, by engaging academia alongside frontline providers, healthcare professionals associations, and other stakeholders, these tools strengthen the capacities across the ecosystem and help translate knowledge into coordinate, evidence-informed action. Colleagues, I end by asking the same question that I started by this conversation with: why are we not doing that? These resources have a potential to improve and move HPV vaccination beyond a standalone clinical intervention and position it as an integral part of comprehensive adolescent and youth SRHR. Thank you, and back to you.
Thank you, Dr. Khosla. Indeed, very important points, emphasizing the urgency to act and importance of sustained collaboration, especially now. Thank you. Moving on to get another perspective from civil society engagement. Let me invite Natalie Barney-Hopkins from Cancer Research UK. Natalie, from your perspective, what is one concrete way civil society organization partners can use this course in their existing work?
Yeah, thank you, Mina, and thank you to all the other panelists for talking today. A really practical way that we see that civil society partners can really use this new global HPV vaccination course is to include it in their staff training, and then with any other healthcare worker engagements that they may be involved with. By adding this course to existing training programs, you can really support efforts to equip your frontline health workers with clear, evidence-based, accurate information about HPV vaccination, which will hopefully counter some of the issues that have already been mentioned, talking about the vaccine safety and how really to communicate it and talk about it with families. So it's really informing and normalising HPV vaccination as cancer prevention. And I'd also really encourage any cancer leaders that are out there who are listening today to reach out to their country medical societies to really discuss opportunities of how to partner us on this initiative. We know that collaboration and working together is something that will really kind of help drive this movement forward. Thanks, Minu.
Thank you, Natalie. Great examples, actionable examples. Moving on to Dr. Carlos. How can medical societies integrate this course into their existing structures, whether through continuing education, practice guidelines, and quality improvement initiatives?
Oh, thank you very much for this kind invitation. It's an honor to be here. And of course, for International Pediatric Association, this is a priority. We talk about every child, every age, everywhere. And it is a very easy word to say, but right now in this world, in this complicated world, it not always is easy to achieve these issues. For the International Pediatric Association, we are in continuous working with more than 170 societies, pediatric societies around the world. And we think that it's a very strong opportunity to talk about this issue. As a pediatrician, we are leadership in our communities, but we are stronger when we work as a team. And as a pediatric societies in different parts of the world, we have different challenges, different things to do. By example, it is in some countries in Latin America or whatever part of the world, this is a topic that people don't want to talk about it. If you talk with the parents about HPV vaccines, they don't want to talk about it. So we need to talk about education and continuous education, not just in the pediatrician or professional healthcare, but in the population. We need to remember that we are a leadership in our communities. We need to remember that we are a leadership in our countries. And we need to work as a team, not just with pediatricians. We need to work with teachers, with schools, with other societies, civil societies, But above all, we need to work together with all authorities in each country, because they are making decision policies that sometimes need to be advised by as a pediatric society. So I think this course is a great opportunity to talk about, and not just once in the time. We need to keep talking about that continuously, because we are just doing our first steps in this important issue. We will have a lot of work to do in the near future. So that is my point. Thank you very much.
Thank you, Dr. Carlos. Indeed, great points. And finally, Dr. Dennis, my question to you as a physician is, what do you think will motivate physicians to engage with educational programs like this? And how can medical societies drive participation among members?
Hello, Minu. First of all, thank you for the invitation to participate in this excellent event on behalf of myself and the Pediatric Association of Bosnia and Herzegovina. That's a great question. Me, as a primary pediatrician working here in the small community IPA Bosnia, I have learned that motivation doesn't come from the obligations. It comes from the relevance, credibility, and the visible impact. I will say that engage in educational programs is real when we see three things. The first of all, I would say that content is a practical and directly applicable to their daily clinical work. In primary care, time is limited, like everywhere. If an educational program helps us physicians to respond confidently to parental hesitancy, improve vaccine uptake, or handle difficult conversation about HPV and cancer prevention, engagement increases naturally. The second one is motivation growth when the education is linked to the measurable outcomes. In IPA Bosnia, once colleagues saw the structured communication and the strong vaccination recommendation led to real increase of HPV vaccination rates here, that interest expanded rapidly. Data drives belief and result sustained momentum. And the third one, I will say the peer influence extremely powerful. When the professional societies highlight the real-world examples from similar practice settings, not only from the large academic centers, of course, members feel that the change is achievable. Seeing the colleagues succeed in comparable environments build the confidence. I will say here the HPV Champions video showed tremendous result here. And because of that, I want to say thank you to Jessica and Minu, of course. And the second question was professional societies can drive participation in opportunities like the course by making engagement professionally meaningful, practically useful, and visibly impactful. Here, the first, they should position the course not just as a passive education, but as a leadership pathway, aligning it with quality improvements in initiative, national immunization goals, and measurable outcomes such as increased HPV uptake. The second, they must provide tangible value, practical communication frameworks, ready-to-use scripts, implementation toolkits, data database, and the peer-reviewed evidence that clinicians can immediately integrate into daily practice. The third one, societies should amplify peer influence by showing the real-world success stories from comparable practice settings, especially from the smaller communities, so members see the change is feasible, not theoretical. The fourth one and the last one, the recognition really matters. Offering CMA credits, certificate of excellent public acknowledgement of local champion and opportunities to present results at the professional meeting reinforces the professional identity and accountability. In the end, I will finish with this. Societies drive participation when they connect education to leadership, tools to action, and the learning to measurable public health impact.
Indeed. Thank you. Thank you, Dr. Dennis. And thank you to our panelists. I will now turn things over to Dr. Thakur for rapid fire reflections from our panelists. Over to you, Dr. Thakur.
We want you to answer something which our participant can carry home. So I will start with Dennis. Please reply in one sentence. What does it mean to be HPV vaccine champion in everyday practice? One sentence.
Oh, it's hard, but I will try. I will do my best. At the end of the day, commitment defines me not only as a pediatrician, but the true advocate for the children's futures that give me profound professional fulfillment of preventing cancer and might never have to treat.
Thank you. Carlos, as a president-elect of IPA, looking beyond individual provider, what is one concrete step a medical or pediatric society could take this year to accelerate HPV vaccine uptake?
Yeah, Naveen, of course, in this year, all pediatric societies belong to IPA need to reply this course. It is very important in medical continuing education.
Good. Thank you. Dr. Natalie, what is most compelling reason medical societies should partner with local cancer organization to improve HPV vaccine?
Well, we know medical societies know the science, local cancer groups really know the community and can also be utilised as trusted messengers along with physicians and can even have a greater reach. And we know when medical societies and cancer organisations collaborate, they are stronger than when they're working individually. So more cancers will be prevented and ultimately more lives will be saved. So working together, collaboration.
Dr. Paul Bloom, if we do not improve HPV vaccination coverage now, what opportunity we are risking, we are missing?
We have a public health opportunity that is not present in every generation. With this intervention, we can save about 45 million lives in low and middle income country of women over the next century. 45 million lives is worth fighting for. Thank you.
Thank you. Dr. Prasad Kulkarni, what gives you the most hope right now in the global fight against HPV-related cancers?
I think there are 2-3 factors that I would strongly count on. One is, of course, there is mounting and huge evidence that has come up that the vaccine is working wonderfully in preventing cancers. Secondly, for the first time, there is a huge scientific consensus that yes, this vaccine is much required, and therefore there is no controversy in the leadership in the scientific community, and not also in the leaderships of the governments. And that also reflects in the wider acceptance of the vaccine, more countries introducing the vaccine, including now India. So I think all these factors make me very, very hopeful for the future.
Thank you. And finally, my friend Sandra, you have to finish this sentence. A future without HPV cancer starts with, finish this sentence.
It starts with us, with a leadership challenge. If we empower the full healthcare workforce and reach every community, this generation could be the one that ends cervical cancer forever.
Thank you. Thank you so much. Thanks to all the panelists and thanks to Minu for moderating this. Now we go to audience question and answer. And I'm happy to introduce Dr. Ayabo Sado, who is a professor of pediatric infectious disease, a director of Institute of Child Health, and she is also co-chair of IPA program area on immunization and infectious disease. So over to you, Ayabo, for the audience question answer.
Thank you, Dr. Tucker. So this was a very engaging session. And so we have about 33 questions. So I would not be able to take all of that because we have just 10 minutes for the questions. But what I've done is that I have merged questions that are that have the same theme. And Dr. Basu has actually answered quite a bit of the questions. So if you ask a question, you can go to the Q&A session to see if your question has been answered. So I see that many people have questions on what the population coverage is that is required to eliminate HPV, and if a 90% coverage amongst adolescent girls will be able to protect boys through herd immunity. So I think any of the panelists, any of the previous speakers can answer the question. Should I take the questions all together, or will speakers answer immediately after each question? Okay, so maybe I'll just read out all the questions and then the panelists will answer. Another theme question is on the age at which we're vaccinating, and I think quite a few of them are from India. there's a question on whether it should be 9 years only or 9 to 14 years. And then there's another question on the age of sexual debut being 13 to 15. So why is the vaccine not given at an earlier age, say 10, to coincide with DPT boosters that are given at that age? So I think those from India should be able to answer that question. Then we have another question on how IPA is integrating local NITAGs to in its effort to increase coverage of the targeted population. And then there's also a question specifically to the course, and I think Dr. Jessica Khan might be able to answer this. How long will the course be active? The person says that 4 hours is too long for him to complete. And so those are some of the questions. Can we answer those, please, while I put the others together? Thank you.
I think we should request panelists, starting from Dr. Paul, to answer, and then others can pick up, because they have seen the questions in the question and answer box. Dr.
Yes,
Paul.
I can shed some light on some of the questions. I'm sure my colleagues can come in. So there's questions about the age of vaccination, and yes, we recommend this age bracket of 9 to 14. We get more and more evidence to know that depending on when sexual activity starts in a community, the best is to be before that moment. So actually, I think it's fair to say that if we can vaccinate around 9, 10, at the moment, it's really considered the best. I know that, for example, India, I saw questions around that. They want to move to that age group, but they start now at 14 to save all the older age groups from becoming too old for vaccinations. And in some time, when there's more vaccine, they will move down to 9 years of age. Another question was, what coverage do we need? Now, we have good news and we have less good news. The good news is this vaccine creates very strong herd effects. So that's good, which means when you vaccinate 80%, for example, indeed, boys are also very much protected. Not all boys, that's why there is a value of also vaccinating the boys. But what is also happening is that when there's very low cervical cancer in a society, very few infections, actually at much lower coverages, we already see very strong herd effects. The less good news is in, for example, the countries where there's very high incidence, we do need to reach very high coverages in order to reach elimination. So there's no one magic, but it is true. We need, in general, we need high coverages and we need to vaccinate early. Thanks.
Thank you very much, Dr. Bloom. I think that others should provide some other insights. For example, we have a question on the number of doses. So single versus 2 doses, which is superior. And then there's a question on, should we discourage those parents who want to take the 2nd and the 3rd doses? And thank you for talking about the age. There's also a question about whether a single dose can be recommended up to the age of 20 years. So those are some of the additional questions that have to do with doses and schedule.
So I think I can see a question that whether a girl of 19-year-old, who has crossed the recommended time, whether she can be vaccinated. Of course, she can be vaccinated. I mean, there is no question at all. We have the vaccine recommended till, the vaccines are approved till age of 42. And of course, the earlier we give them protection, the better, even before the sexual activity starts. So 19, of course, is no problem at all.
So there are questions, and I think maybe Dr. Thakur or Professor Haddad may answer this. How is IPA integrating local NITAGs in its effort in increasing coverage of the targeted population?
So IPA cannot integrate NITAG. NITAGs are integrating IPA leaders. You know, more and more we are working with partners. Ayobo, you know, we are working so closely in Africa, Asia, Central Asia, everywhere, and we are bringing them together through our different programs, vaccine to vaccination, other vaccine programs. So once they are coming together, more and more pediatric societies leadership is being integrated. They are invited to serve on NITAG. So definitely, if there is anyone here, and we will be happy to connect our pediatric society to your country's NITAG if you still don't have that. Thank you.
Thank you
I can
very much.
answer the question about, Dr. Ayebo, I'm happy to answer the question about single-dose vaccination briefly. Many countries, their NITAG has a recommendation for the number of doses of HPV vaccine. So my recommendation would be to follow your country's recommended dosing schedule. However, in terms of the World Health Organization, they do recommend now that a single dose of HPV vaccine can be used for primary vaccination in most adolescents, but there are caveats to that. So for girls and boys 9 to 14, they recommend either 1 or 2 doses, and a single dose may be preferred in many low resource settings. For girls 15 to 20, similarly, they recommend 1 or 2 doses. But for adults at least 21 years of age, they recommend 2 doses. And for anyone who's immunocompromised, including anyone living with HIV, they recommend 3 doses if feasible, and at least 2 doses. So there's not a universal recommendation by the World Health Organization for 1 dose. For most adolescents under 21, yes, 1 dose can be sufficient, but it depends upon the age, and it depends upon whether one is immunocompromised.
Thank you very much, Dr. Jessica Khan. So I think the last question we'd like to take is on the course itself. How long will it be active? And then somebody is asking about a link to register. So I guess Ashria or Madhvita can post that on the chat box for that person. So how long is the course going to be active for?
So I can take that question, and if I interpret the way you asked the question is, how long will the duration of protection be following a course of HPV vaccine, right?
No. It's to do with the
course.
Yes, the course.
HPV
vaccine. That's what the person was asking about.
We have started, and it will be there on LMS platform. Unless after some years we feel that it needs to revision. Soon we will be translating into Spanish and English also, and that will also be available. So course will be active, and you can do in self-paced. Somebody said 4 hours is too long, but it's a self-paced course. Not necessarily that everybody takes 2 or 4 hours. You may be able to do it faster, but you don't have to complete in one go. You can complete at your pace, and this will be there till we decide that we need a revision, not as of now.
Right. Thank you very much, Dr. Thakur. So the link for registration has been posted in the chat box. So you can go there to copy the link so you can register. So we're going to move on to the next session, which is to commit. We've had so many things said, and we have heard about this very beautiful course that we're going to take. So we'd like to have your commitment on a few things. So please, can we have the first poll posted? Okay, so do we commit to taking the course? Do we commit to engaging our medical society? Do we commit to sharing the link for the course with others? Do we commit to using resources like posters and handouts in our clinics? And I dare say also on our social media platforms. So let's commit, vote. So this shouldn't take too long. I believe we can commit to every single thing that is here. Okay, so single choice. So taking the course, engaging my medical society, sharing with others, using resources, posters, handouts in my clinic. So let's see.
Result, yes.
Oh, that's very nice. So we have 54% who are going to take the course. We have another 9% who's going to engage with their medical society. We have 20% who will share with others. And then we have 17% who will use the resources. So I'd like to conclude by saying that for us to reach every community and reach every child, it requires collective effort. And we have to make this commitment, and I'm happy that we have done so. So permit me to invite the next person who's going to give us the closing inspiration. This is in the person of Dr. Carlos Alonso Rivera, who is the president-elect of the International Pediatric Association. You have the floor, sir.
Thank you very much. Thank you very much all for being here in this important course. As we close, thank you for standing with us today in this global movement to protect the future generations. We are united by a simple but powerful goal: to protect every child and adolescent everywhere from HPV-related cancers. Pediatricians and primary care healthcare professionals have long been trusted guides for families, and that trust has the power to save lives. The science is clear. HPV vaccinations prevents cervical cancer. The tools are in our hands, and the opportunity is now. What's needed is confident, informed action, clear recommendation, delivered with consistency and compassion at every opportunity. On this International HPV Awareness Day, we call all pediatric societies, frontline clinicians, and global partners to step forward as champions for cervical cancer prevention. Complete this free online training, share it across your networks, and help ensure that healthcare professionals are prepared to address misinformation and support families with clarity and confidence in their clinics and communities. Every conversation, every recommendation, and every partnership brings us closer to a world where cervical cancer is no longer a threat. On behalf of the International Pediatric Association and my partners at the American Cancer Society, I thank for your leadership and commitment. Let us live today inspired and united, because cervical cancer is preventable, and without collective action, we can be the generation that ends it. Thank you very much.
Thank you. And here we close the webinar launch. Aishwarya? Okay.
Yes.
Thank you.